Well, thank you very much for giving me the chance of being here. I believe that this is a wonderful opportunity and that it answers, of course, this need of coming together. I believe that it's extremely useful. And beyond the pandemics or catastrophic events such as Ebola in Africa, in Paraguay, we have recurring sicknesses such as dengue and chikungunya, and this is something that repeats itself yearly. However, we understand that there are other events that are very important, and of course, being able to build resiliency in a community in specific so that we know how to help them beyond the tr traditional medicine that we use or Western medicine. And something that I would like to add, and I believe that I actually lived it when I was part of the health ministry, specifically during the pandemic, was actually understanding that the pandemic will also have a chance for the community. And that means that you prepare yourself for that very difficult moment when you are scared, where we have vertical or some military actions that might take place. Actually, in our country, we had a similar situation. And then we also need to consider, of course, doctors. And what the doctors are saying is law, because they are now having a different social status with a very specific discipline mandate. And they basically don't discuss this with the community. It's just following their word. But we also need to understand that there are social stages during this events. First, we have, of course, fear, and then we lose fear, and then you get tired. The community actually tires from this situation. And then we also need to understand how you will act as community. So you need to prepare yourself for each one of these moments. And it's not just the shock, the initial shock. I believe that we need to understand that this will all take place and we need to prepare for those moments. Preparing for a pandemic is a collective effort. It's not an individual effort. And I would like to highlight that in my country, and I think that this is something that was mentioned during the experience of Sierra Leone. I think that in Paraguay, the Latin American culture is strong, specifically with how important women's roles are in regards to taking care of others, especially for those countries that have very poor social protection structures, where we see that this collective culture and women become basically the carer. So it's usually the mom that takes their children to get vaccinated, or their husband, or everyone else. And they're usually the ones that are constantly giving and providing care and recommendations for the community. So in Paraguay, it's very important for us to understand this, negotiate it, and then also empower women within this culture and provide them with tools so that it can multiply in the community. In Paraguay, it was extremely interesting seeing how there was a point where it was really difficult to acquire food, not so much due to the military being on the streets, but because there were some areas that were inaccessible and it was very difficult to actually have access to food. So it was through this network of women, of mothers, that were finally understanding that it was their role, or that they were the ones in charge of being able to feed their families. So that's when they started coming up with community groups where they were able to basically cook together so that everyone could eat. And of course, after the government realized that this was taking place, they were able to empower them. So it's basically understanding the potential that communities have and empower them and strengthen them. So understanding these codes and these networks, and of course, the job that you're doing, I believe is extremely important of giving value and building a framework so that government, men who are usually in the lead, can actually see the power that lies in communities. And beyond that, I believe that we also questioned communications. In Paraguay, we had really bad communication, and I think that it was a global issue. But something that is very important was this risky communication, where we need to understand how can the scientists and the health ministry can actually listen to us. And I think that this is part of this step that you are taking, and I believe it's amazing. But I will, of course, stay here so that we can keep on with this discussion.